Journey into Ayurvedic Healthcare, brought to you by Troops and Tunes. Hello, my name is Jenny, Ayurvedic practitioner in training and volunteer for Troops and Tune. Please join me as we explore Ayurvedic Healthcare. Lesson 3, Ayurvedic Health Goals and the Disease Process. To create proper healthcare goals, we need to understand the healthcare system. Western medicine has specialists to help treat symptoms of a specific organ. For instance, if you had tummy problems, you would go see a gastroenterologist, or if you had heart problems, you would go to a cardiologist who would help treat the circulatory system. Western medicine has labs and tests to help treat signs and symptoms. Functional medicine treats the body as a whole, looking at the patient, mind, body, and spirit. It identifies and treats the root cause. Functional medicine puts great emphasis on the patient's life story and experiences, their triggers, and mediators. Functional medicine takes account the person's lifestyle, such as their sleep, their exercise, their nutrition, their stress, their relationships, trauma, microorganisms, and environmental pollutants. Functional medicine states that energy drives function. Ayurveda fits underneath functional medicine. Ayurveda proposes that disease results from an imbalance of the energy management system. Both Western and functional or integrative medicine have primary and secondary care. Primary healthcare is people-centered rather than disease-centered. It addresses a majority of a person's health needs throughout their lifetime and includes physical, mental, and social well-being. Primary care is the first level of care that patients receive. This could be self-care or going to a doctor. It also takes a whole societal approach that includes health promotion, disease prevention, treatment, rehabilitation, and palliative care. Secondary care is the type of care provided by doctors or specialists, usually from a hospital or clinic. These services may also be community-based. The definition of health, according to Ayurveda, is one who is established in self, one who has balanced doshas, primary life force, balanced agni, fire of digestion, properly formed dhatus, which are tissues, proper elimination of malas, which are waste products, well-functioning bodily processes, and whose mind, soul, and senses are full of bliss. This is called a healthy person. One of the first Ayurvedic health goals is to become established in self. This means understanding your Prakriti, the energy that you're born with, and ideal state of balance, your imbalances, Vikruti, and understanding that imbalances can change based off the seasons, your age, illness, or present injuries, and also your mental energy, and understanding the universal energies of Sattva, Rajas, and Tamas, and how to move your mental energy into a more balanced state of health. Doshas are a broad concept. We want to balance the doshas, balance the elements, and bring awareness to the qualities. Vata is ether and air, and it has qualities that are dry, light, cold, rough, subtle, mobile, and clear. Pitta is fire and water, which is qualities of oily, sharp, hot, mobile, and liquid. Kapha is earth and water, which is heavy, slow, dull, cool, oily, slimy, smooth, soft, dense, stable, sticky, and cloudy. Dosha in Sanskrit means fault. It is an energetic force of qualities that can cause disease when in excess or out of balance. Lots of factors cause imbalance, such as diet, lifestyle, stress, genes, karma, and other external factors. Ayurveda uses the term doshas to explain your body constitution and your imbalances. This can seem confusing and complex, but to keep things simple, in order to understand the doshas, it's best to really put an emphasis on the 20 qualities. We are trying to understand what qualities are in excess within our body and externally. Ayurveda understands the laws of nature and really teaches us to follow the laws of nature and honor these laws so we can bring balance and health. The doshas are explained within time. There is a dosha clock, very similar to the circadian rhythm, and matches kind of our times of digestion. There is Pitta, which is 10 to 2 a.m. p.m., Vata, which is 2 to 6 a.m. and p.m., and Kapha, which is 6 to 10 a.m. and p.m. Within that, there are the seasons, which spring is Kapha, summer is Pitta, and fall is Vata. Winter is a mix between Vata and Kapha. And within that, we also have our lifespan. Our Kapha years are between birth and 13 years old. Our Pitta years are from 13 to 50 years old. And our Vata years are 50 until death. To see what qualities are in excess, we bring opposite qualities to bring balance. Keeping this very simple common sense approach, you're able to enact proper self-care to pacify the doshas that are in excess. So this means if it's cold outside, wear a jacket, a hat, or some gloves, and this will keep you warm. By keeping it simple and basic, we're able to identify the qualities, the elements, and the doshas, and what type of self-care or qualities need to be acted within your daily life. Ayurveda states that there are 6 stages of the disease process. Within Western and functional medicine and primary and secondary care, we have to discern and learn when to seek help, when to go to the doctors, when to enact proper self-care, proper nutrition and lifestyle guidance, and then when to seek out specialty care. So within this example, we have stage 1, accumulation. And within Ayurveda, this is an accumulation of a dosha, which is Kapha, earth and water, Vata, ether and air, or Pitta, fire and water. In this example, we're using fire or Pitta. So it's just like eating something spicy. We're going to use the example of lighting a match. And you're lighting a match in your home, and you're just throwing these lit matches onto the floor. And every time you strike one, you just throw it on the floor. You start accumulating matches that are burning. Some of them continue to burn, and some of them just burn out. Eventually, we move to stage 2, which is provoking the dosha. So you have lit a bunch of matches in your home, and they've fallen on the floor, and now the floor has caught on fire. Now the drapes have caught on fire. Now your whole house has caught on fire. You have provoked the dosha within your system, within an organ, say the stomach, and is caused an imbalance. Lots of people start to recognize or feel an imbalance with very subtle signs or symptoms. Maybe you have sour burps, or you feel like a little bit of heartburn, and you start to enact a level of self-care. Maybe you take some Tums or an antacid. In this example, maybe you're like, oh my gosh, my house is on fire. I need to go get some water and put it out. But if we continue to be unaware of this fire, of this heat that we're doing to ourselves, that we're putting into our body, into our home, striking the match and continuously throwing it on the floor, making the fire bigger and bigger, eventually it's going to spread. And we move to stage 3. The neighbor's house is on fire. No longer your single home is on fire. You have caught your neighbor's home on fire. And this fire is beginning to spread. So not only has the pitta, the dosha that has been aggravated in your stomach, it's starting to spread. Maybe you're getting aggravation in your throat. Once the fire spreads, it begins to localize. So not only is it catching other buildings on fire, it's catching maybe the fences, or in this example, trees, the grass, just random things that are in your neighborhood. They're just starting to catch on fire. In this example, the dosha has found weak places or places within the system, say your digestive system, that already maybe have a little bit of extra fire. We're going to add more heat there. That's what your body is just naturally doing. It's adding more heat to that area. It's found this weak spot and it's beginning to localize. And once that happens, we go into stage 5, manifestation. We start to manifest symptoms. And these manifestations, within the example, we're seeing smoke and fire. Maybe you're hearing people screaming. You're hearing sirens of people's fire alarms. This manifestation is signs and symptoms that your body is crying out to you. If proper care has not been taken, such as maybe seeing a specialist or going to the doctor or enacting proper daily self-care over a long period of time, we're going to move into stage 6, which is destruction. This is where chronic illness sets in, chronic disease. It can come slow, or maybe it's very fast. We're all different, and the way our body reacts to these changes and imbalances is very unique. It's very unique to your body constitution and the way the disease has manifested within your cellular tissues. Ayurveda is helping you understand when to enact self-care, when to enact the primary care that you need for yourself, when to see your primary care physician, and when to go see specialists. And this also means within the Ayurvedic healthcare system, when to see an Ayurvedic health counselor. You would definitely want to see them within stage 1, 2, or 3. After stage 3, you can seek out an Ayurvedic practitioner or an Ayurvedic doctor for stages 4, 5, and 6. Understanding the laws of nature and the qualities and elements, we also need to understand how to nourish the doshas to change our vikruti and bring our imbalanced state back to a balanced state. Pranas, Tejas, and Ojas are subtle energy forms of the doshas and 5 elements. Prana, Tejas, and Ojas should be at an optimal level based on your body constitution or prakruti. They can also be out of balance or displaced. Tejas comes from pitta. It is a burning flame of pure intelligence that encompasses light and heat. It is a part of Agni as a fire. Tejas is the transformation and metabolism within Pitta and Agni. Tejas give color to skin, eyes, tissue, and aura. Tejas is intelligence, awareness, and pure love. Agni is also another Ayurvedic healthcare goal, to maintain Agni, which is fire throughout the body. It's responsible for digestion and metabolism. Tejas is present in Agni, giving the powers of discernment and intelligence to maintain cellular function. Agni is the movement of the intelligence of Tejas. Ojas comes from Kapha, pure essence of all bodily tissues, maintaining the body and immunity. A biological substance that includes various hormones, albumin, and globulin. It creates our tissues or dhatus. To have balanced ojas, focus must be brought to Agni or Tejas to increase the quality and assimilation of nutrients. Ojas protects prana, our vital life force. Preserving the dhatus is another goal of Ayurveda. Ayurveda puts an emphasis on nourishing or cleansing the body on deep levels. There are many benefits to taking proper care of the tissues that support our health. The 7 dhatus give an important insight to the building blocks of nature and how to obtain proper cellular health. By rejuvenating the Kapha dosha by bringing ojas with diet, herbs, and lifestyle, we can find healing and improvement on a cellular level. The proper elimination of waste products or malas is also another Ayurvedic healthcare goal. There are cellular and metabolic waste that shows up in our feces, urine, and sweat. The way the body rids of waste products is just as important as taking in nutrients. The concept of Agni shows up in the cellular discernment to make the proper exchange of nutrients and waste. Ayurveda has many therapies to clean and revitalize the body. Prana comes from Vata, and it governs motor and sensory functions of the brain, including memory, thought, and emotions. It is responsible for respiration and circulation. Prana also governs Ojas and Tejas. It is responsible for the movement of energy, breath, thoughts, and emotions. The bridge between masculine and feminine energies brings soma, which is cell cytoplasm, and oxygen to nourish and bring consciousness to the cells. Within prana and vata, there is manas, the mind. There is a mind in every cell, an awareness and consciousness. The mind is connected to the autonomic nervous system and chakra endocrine system. The mind is sensory, perception, thinking, and emotions. While buddhi is intellect, cognition, retention, and memory, the mind creates our perception of our internal and external realities. We use the breath to allow prana to move and facilitate the energies in our body, mind, and spirit. Through sattva, rajas, and tamas, we can come to a grounded state of mind to remove judgment and suffering. Prana helps shift our mental energetic states. When working with prana and vata and the mind, we're working with the 3 universal energies of sattva, rajas, and tamas. We want to bring ourselves to a more sattvic state, which is we're able to allow ourselves to see and observe. This may look like observing or responding versus reacting. A rajasic mental state is a state that is maybe fast, having lots of thoughts, lots of ideas, lots of positive forces that will initiate change. Tamas is more of a stagnant energy. It's an obstructing negative force that sustains old patterns. By using prana, we're able to bring our mental energy into a more observant state to where we are allowing ourselves free from suffering. Ayurvedic health goals are to be established in self, having the intelligence to care for the body and to use functional and Western medicine to help treat mild to chronic imbalances, using primary measures to maintain health and longevity.